years later, when there has been controversy about whether these medicines work at all for depression, I think they do. They clearly do. But since that was brought into question, people on the web would say, "Hey, Kramer, how's that better than well stuff working for you?" And as if arguendo, say that these medicines didn't work for depression, that would also mean they don't have personality effects. But really, the research on the personality effects is extraordinarily consistent and, almost uncontested. The research seems to show that something happens to personality along these lines, and, in a way that's broadly measurable in big populations of patients. And what's in question is it just Prozac or Paxil or whatever's been tested? Would it also happen with imipramine and the tricyclics, the older drugs, if people were as comfortable on them and not as much attending to side effects, if they were used as frequently for less ill patients? Or is it just recovery from depression, that as people recover from depression, they tend to become more socially comfortable and more assertive and so on? Although I think the very best and most careful studies really say no, it's the SSRIs, it's these new medicines, and that in some of these studies, the effects on personality, the standard research is a decrease in something called neuroticism, which is vulnerability, emotional vulnerability, that the decrease in neuroticism is stronger than the effects on depression. So in the sort of how's it working for you sense, research is really very supportive